Deputy Luke Flanagan, next 10 minutes.
Thank you, Les Cahirlock. There are places in the health service where you would say you couldn't cut back anymore, and that is for definite, and there's more money needed. And then there are places in the health service where, when it comes to capital spending, it seems that the worst possible thing that could happen to your hospital or a facility is that the government upgrade it. And in the 70s in Roscommon, they upgraded the maternity unit, and guess what? They closed it before the 70s were over. In the noughties, they upgraded the A&E in Roscommon, and guess what? It was closed. And we now have a situation in Galway where we have 3 million spent in Ballinasloe on a high-class unit with unbreakable windows and unbreakable toilets and ligature-free environment for what now is going to be geriatrics. So it's one thing saying you're short of money, and in certain ways you definitely are, but there's two reasons for it. One is that, we have socialists like Senator Lorraine Higgins who have a problem deciding whether we should tax more and cut services or not. But the other reason is because there is money wasted. Now, on Friday night, I've attended a lot of meetings over the years, as I'm sure everyone who is in the Dáil has, many meetings. But the meeting I attended on Friday night was probably the most emotional meeting I was ever at in my life. And we heard a situation in the psychiatric unit in Galway, which is where you're planning to shoehorn people in from Ballinasloe when you rip the beds out of their arms and do close it. We heard of a tale from a clinician in there that 31 people were expected to share 3 showers. And, it isn't that bad. They had 1 bath. Well, guess what? The bath apparently doesn't work. All that comes out of it is scalding hot water. We listened to stories of how patients shiver in corridors while they wait for a shower. Now, I seen one flew over the cuckoo's nest on quite a few occasions, and the only bit of hope that I got out of it was that, well, you know what, at least it's not like that anymore. Now, at that meeting on Friday night, we heard tale after tale after tale. But apparently we're just NIMBYs for saying this. Well, Dr. Barton, who was at that meeting, is anything but a NIMBY. I'd criticise him for one thing. He ran for Fine Gael at one stage, and he tried to convince people to vote for Fine Gael, but no one is perfect. But at that meeting, a man who is a clinician, he has no political axe to grind, he only cares about the patient. And on 2 separate occasions when he was explaining why he was so distressed that they were going to close the unit in Ballinasloe, he broke down. He had to wipe the tears away from his eyes. Obviously a NIMBY at work, according to the latter-day Margaret Thatcher, Minister Thatcher we'll call her, because she did say she never hoped she'd sound like her, but now she does. At least she knows she sounds like her. So, we can talk about finances all day long, but when you do what you're doing with the finances that you have, and you close down a good unit that's working perfectly well, and you shoehorn them into a place that has a duck pond on its roof because there's so much water building up on it, and the water is being held up by RSJs, and people are ending up waking up in wet beds. And we're told, which that happens everywhere. It's raining all over the country, and sure, everyone's house is leaking. Well, sorry, I don't live in a dump, and my house doesn't leak, fortunately. And I'd love to know where these HSE officials live if they think that that's normal. So anyways, you'd imagine to shut us up saying these things, because it would be good if we were shut up, because I hate saying this, because it discourages people from using that unit. And as someone who had mental health problems in the past, and as someone who comes from a family that suffered from the black dog visiting their door on a regular occasion, I don't like saying this. So I went to the hospital the following morning after that meeting to try and see the unit. Now, I was wary of going because the last thing you want to do is impose on people. But when we arrived there, we were told we weren't allowed to see the unit because of patient confidentiality. Legitimate excuse. Legitimate if there was anyone in there. We were told, no, you're not allowed in. And actually, this thing that we're not going to let you see, the glorified one flew over the cuckoo's nest institution, we were told, actually, there's 5 showers working. Now, it's like dealing with a child and them saying they've done something, and actually I have something behind me back. Well, will you show it to me? No. You get suspicious. Maybe they do have something in their hand behind their back. Well, the reality is, what were they hiding? And if they're that sure it's that good, why would they not let us in? Now, anyone who says we have a cheek to go there should remember that a year ago we were being asked to go to this unit to see how wonderful it was. But now when we want to see it, we're not allowed to see it. What the hell are ye hiding? We now have a situation where we have a system that's working perfectly in Ballinasloe. You're closing it down. Now, last night, an extraordinary event took place. I was on my way back down to Castlerea for a particular reason, to visit my family, and I discovered, a worker that was there, that there was a protest going out outside the gates of St. Bridget's. And the people, fair dues to them, had gathered in numbers to physically stop the removal of the beds from the unit. Now, the HSE seemed fit to call the Garda Síochána. You could hardly call this respect for the whole issue of mental health. Calling these people NIMBYs. These were parents and relatives of service users that turned up there last night, along with staff, to defend what rightfully should have been defended. Now, we met Kathleen Lynch a couple of months back, and I have to say I was fooled by her for a while originally. She sounds like she empathises, sounds so much that I actually believed her for a while. But I stopped believing this lady, the latter-day self-named Maggie Thatcher. She told us that the reason why they spent so much money on this unit that you wouldn't be able to hang yourself out of, that you wouldn't be able to throw yourself through a window, and you wouldn't be able to smash toilet bowls. She said, this is for elderly people, and I asked, why did you spend all of this money on an inappropriate unit? And I was told with a straight face that the elderly only deserve the best. Now, if the elderly deserve the best, you would have saved money there and had more services for them in there, instead of spending it all on capital funding and then not actually using it. We also have a unit in Galway that is empty at the moment because apparently we can't afford to staff it. Now, every time someone commits suicide, it's in the paper and everyone is rightfully sad and shocked. But at this stage, we would have to say conclusively that the tears that are being cried by the government are crocodile tears and nothing else. Because if you cared about this, you'd keep what worked and you'd get rid of what doesn't work. Now, what are you planning for the future? You're planning on moving everyone into Galway City. Apparently you're going to build a new 50-bedded unit. I actually don't believe that at this stage. But even if you did, you're putting another facility in a place where there's no room. Now, I personally and my family had to go through the anguish of queuing to go into a car park, wondering whether my mother would be dead by the time we got a parking space. I'm not exaggerating. This happens on a regular basis. And now your master plan for people with mental illness is to bring them into a crowded area, into a stress-built area, whereby if you weren't stressed or you didn't have a mental health problem going in, you would certainly have one coming out. Because it is hell to get there. Now, if we lived in Hong Kong, or we lived in some Chinese city where there was no room, fine, build it on that site. But we live in the least congested area in the whole of Europe. And the best way to get someone better is to put them into an environment where they can breathe in the air and not the diesel fumes, where they can roam around the wild countryside, which they can in Ballinasloe, but not to put them into a place which will destroy their mental health. And I say this not as a politician, not as a NIMBY, but as someone who cares about these people. And I have lost hope in the fact that ye care. At this stage, this is not politics. War has to be declared on ye because of what you've done to these people.
Now called